Well, this year marks the second anniversary of a program at Children's Minnesota that focuses on partnerships in our communities. It's all to make sure when kids head out the door, they're safe and they're healthy. And to tell us more about what they've seen through the Collective for Community Health program, we have James Burrows and Susie Velasquez from Children's Minnesota. Thank you, friends, for coming in here. You all are busy. You've been doing a lot of work.
We have been. Thank you for having us. Appreciate it.
Of course. Okay, so help me understand exactly what goes into this program.
Sure. So think of the Collective for Community Health as we have a vision at Children's Minnesota. We want to be every family's essential partner in raising healthier kids. But that doesn't happen inside our four walls. So in the community, things happen. People go to school. People need to get food. People need to have jobs and get housing. Those kind of things are very important. And what we said at the Collective is we need to partner with the community and make sure those things happen for our kiddos. So when they get to the hospital, they're living healthier lives. So when we treat them, it's something they're doing, going back to this, enjoying themselves in the community.
So many people understand and they've heard the name Children's Minnesota and they think, okay, obviously we're going there, we need something, right, to help us be a little bit healthier. But talk to me a little bit about how this program has helped for all the things to make sure that they don't have to go to Children's all the time. Tell me a little bit about the program.
Absolutely. Community Connect is a program that started in 2017 after they did a survey for social determinants of health. And we were just trying to figure out how can we support families. We have a staff of 5 wonderful navigators that speak and the language with patients, and they're able to connect with families throughout the community. So they come from the community to help the families, and they build a relationship. And the way that the program works, we're able to give a questionnaire so that the families can complete it, and it focuses on food, transportation, legal aid, childcare, adult education, and household goods. So in order for us to do that, we connect with the families and we build a relationship with them, and that's how we're able to close that gap, and where we know that 80% of health to children is tied to where they live, learn, and play. And we're able to build those relationships with the families, and we walk them through until they're ready to say, we're good, we're at a good place.
I love that so much, showing the process. I tell people all the time, my favorite part about talking to people like you both is that I feel like we get a little bit smarter. What's one conversation that you feel like has really emerged from the work that you're doing that many people are not having in their homes, but they should?
So with that, the families that we've been helping, we've been successful with the families that we just recently happy to share that one of the families that we were helping with just started working with Children's Minnesota.
Wow.
Because it comes down to where, how the family's living and working and all of the resources that they need. So we go and talk to them, and we follow them along. And this family was looking for a job, and we connected with our talent acquisitions department, and it happens so they get connected, and now they're working with Children's Minnesota, which is awesome.
Such a cool ecosystem. James, before I let you all go, what's the dream here and how can people be a part of this?
Well, the dream is to continue this throughout for all children's lives. And the only way we do that is with funding from organizations. I want to thank United Health Foundation for granting us $3 million to do this work, because a lot of this work is not reimbursable by insurance. So we need grants, we need donations as well in order to sustain the work long term, because if we sustain it, kids will be healthier, we'll have healthier communities, and we'll all be better off.
Such a great resource. Thank you all for making us a little smarter today. And of course, you can learn more about the Collective for Community Health program at Children's Minnesota on our website at KARE11.com/news.